In the heart of Yorkshire,
Hello, emergency department.
an unbeatable team.
That way.
And stop, we're going to lay you down.
Hard at work 24 hours a day,
Does it count as a daily exercise?
7 days a week,
I can smell it now. It's a really bad burn.
saving lives,
It might be that we need to put you to sleep in order to try and sort this out.
helping loved ones,
It's a shocker, that.
making the community they serve better.
We got you, lad.
You've been such a good boy.
A health service treating anyone
Car door, house door,
Van door.
big van door.
So it's quite impressive, isn't it?
and everyone.
Oh, you're going to have a good black eye.
Are you doctor?
A team doing anything and everything for each other.
It's just been mental down here. I will do it, I'll get to it.
We're strong people in Barnsley, you know.
This is Barnsley Casualty 24/7.
You're absolutely all diamonds. Brilliant.
We fixed him.
On shift tonight,
I can smell it now.
advanced clinical practitioner Chantel,
He's just had 50 milligram of IV morphine now for his burn. So it shows how much pain he's in.
emergency nurse practitioner Becky,
I think it's probably because he's pulled. If he'd have opened the door, it would have probably still been intact.
and Sister Jane.
The doctor wait's just so bad.
So, get ready to share a shift with the team at Barnsley Casualty.
Everybody here has been fantastic. And they didn't pay me to say that.
This morning in Barnsley, the casualty department is overrun with patients.
Where are all my nurses?
Resus is full. Paramedics keep delivering more by ambulance. And there's no room left in the waiting room.
I don't know where that patient is. Kerry? Where is he?
Sister Jane, who's running the hub today, knows exactly the reason why.
He's busier than what it would be just because we're just a bit short on nursing staff today. So it just makes it more difficult. I think I'm 2 or 3 down. I'm just waiting for the 2 of the lead nurses to come back out. The impact is massive. And if you ever watch a nurse at work for a period of time, she's got loads to do.
Yeah.
Come with me, sweetheart. Sorry for your wait. When patients are still coming in through the front door, they need seeing within a certain period of time. It has an impact to the doctors because they're wanting to get them out and onto the wards as quickly as possible to make room for the new ones coming in. Hi, lovey, it's Jane downstairs in A&E. I've got another man for you. I'm really sorry.
And now, there's an emergency. Unusually, advanced clinical practitioner Chantel has been urgently called over to the shower unit.
What's your name, sweetheart?
Sam.
Hi, Sam. I'm Chantel. I'm going to come and see you, sweetheart.
Okay.
Some of the nurses said that they could smell burning in the department. Sweetheart,
Put these off down. I'm going to go out.
can we get her apron on? Oh, I can smell it now. It's a really bad burn.
27-year-old Sam has been rushed into A&E after setting his body on fire. The triage team immediately sent him to the shower unit to try to stop the burn spreading further.
Right, tell me what's happened then.
So I've been told to burn like a pile of vegetation and covered it in petrol and
Okay.
the vapours like engulfed me.
So where is this from a working? Like, do you work in that
Yeah,
place?
this is at work.
At
yeah.
work. Tell me what vegetation is, because I just thought you said
It's like
vegetables.
a pile of brash and grass and
All right,
branches and stuff.
okay. That's fine. And I'm guessing you've popped petrol on it.
Yeah.
Okay.
A little bit too much by it looks.
Oh, you have? And then it's all gone up, and it's then gone up your arm.
It's engulfed me. Like, I've been on fire, like my t-shirt was on fire.
Okay,
So-
sweetheart. On the scene, what did they do for you?
They just like run it under water and then give me a bucket and just put my hand in the bucket.
When I first saw Sam in the shower and just seeing the skin hanging off his arm, that were quite... It's not every day you see someone's skin hanging off their arm. But I want to absolutely douse this. I know you're cold and I know you feel a bit awful at the minute. I can't imagine what it must be like to set yourself on fire. So I think he's well within his rights to be absolutely petrified. I know you're cold, sweetheart, I know.
Now they've managed to calm down the burning, advanced clinical practitioner Chantel needs to assess how much of his skin has been affected.
I'm not on my phone. I'm working out your burns. It's ear, nose, partial thickness to his neck and back, full thickness to his arm, partial thickness to his leg. So it's 18%. He's 90 kilogram. We'll get a cannula, some morphine, and we'll give him some fluid.
Yeah.
Right.
Should we dry you? Step on one.
Step on one. Let's dry your legs.
Sam is in danger of going into shock. Nearly a fifth of the surface of his body has been destroyed.
Are you okay?
I think so.
Sometimes people forget that the skin is an organ and that when that organ has been damaged, it has further consequence on other organs.
So it's not the surface damage she's most concerned about.
When you have a severe burn, you lose a lot of fluid through the burn. This can drop the blood pressure. Just want to keep you warm a bit. So the kidneys and the brain and the heart aren't getting enough blood supply. Watch your arm. He could go into multi-organ failure.
Sam is taken to resus, but if his internal organs do start to fail, he'll need life-saving emergency surgery.
And that's something we don't want to happen.
In Barnsley Casualty today, Sister Jane is short of nurses.
Still bad. Still the same. I've not grown any. I've not managed to grow any.
She's desperately trying to stop the whole department from seizing up.
Hey up, love, hey. I've got 9 waiting for beds on AMU. My only problem is I've got a 4.5-hour doctor wait, so I've just got no flow in the department from the doctor wait. There's always another problem that pops up within the department. You know, you think your ship's sailing smoothly and then something will come and throw a spanner in the works. All right, I know. All right, lovely. Cheers, bye.
Over in resus, 27-year-old Sam is in shock.
Well done, sweetheart.
Advanced clinical practitioner Chantel is treating him for severe burn injuries he sustained at work.
Let's get you some good stuff in.
She immediately administers a first dose of morphine.
So I've calculated Sam's percentage of burns to his body and it's roughly about 20%. So my first priorities are to, 1, give him pain relief, he's in a lot of pain, and 2, give him some fluids as well. I know Sam's really scared. Do you want someone to send these off while I calculate all his fluids for resuscitation?
Sam's skin wounds look serious, but advanced clinical practitioner Chantel is more concerned about avoiding complete internal organ failure.
I don't know if I'm cold or shaking.
Especially from a burn, you can get quite a lot of leaking. He's really high risk of losing a lot of fluid. Imagine your plumbing, if you'd got like a radiator leak of various radiators and the fluid were leaking out the radiators, there'd be none in the system eventually, and the combi boiler is the heart. So if there's nothing to go around and the heart fails. It's plumbing, basically, it's plumbing interiorly. What time did you get burnt? Can you remember? Roughly?
About 3 o'clock.
3 o'clock? Are you still in pain?
Yeah.
How bad's your pain out of 10?
7 or 8.
We'll get you some more morphine.
Sam's having to take on huge volumes of fluids and pain relief in a short space of time. His body is in danger of shutting down at any moment.
He walked in, so he's bypassed the ambulance crew. But if the ambulance crew got to Sam, and with the severity of the burn, how deep it was, how large it was, he would have automatically gone to the burns unit in Sheffield. Right, I'm going to have a look at speaking to Sheffield about you're okay. You'll need to go to a specialist burns unit, okay, so they can look after you. And over there, they're really it says really specialised. Burns are specialised anyway, so they've got the correct dressings and stuff, how to nurse you and look after your skin, okay, and get you back to normal without minimal scarring. You've also burnt your nose and your face and your ear, which are specialised areas as well, so they need intense care.
Okay.
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 All right, love.
But until the team at Barnsley Casualty can get Sam's condition stabilised, he won't be going anywhere.
They're going to get you some IV paracetamol, some IV morphine.
Okay.
Okay, and I'm going to sort you out.
With advanced clinical practitioner Chantel already allocated to Sam, consultant Dr Barath Reddy has had to be paged because a new patient has arrived in resus.
Shazza? Yeah? Have you got some x-rays up there? Thank you.
74-year-old Grandma Brenda has had a fall at home and needs an emergency procedure on her wrist.
I got this game on it. It's a daft. It's like table tennis miniature on a bat, and you've got to try and I've started stumbling backwards and I fell into the fence because I'm stupid.
Son David is on hand to support his mum, and Dr Reddy won't be hands-on treating today. He's there in a support role too, supervising the young medics.
Hello there, Brenda. My name is Dr. Reddy, one of the consultants here. I'm going to be observing from the side. Just make sure that they're doing their job properly. Okay. No pressure at all for them. All right. What she's got is a broken wrist that needs manipulating. So I'm just going to be observing both of them with a view to do some assessments for them as trainees. So that's my role. So I will be keeping quiet in a corner.
What are we working with?
It's a radius, comminuted radial fracture.
Specialist orthopaedic technician Paul arrives to give student Dr Stanley some pointers on how to best reset the bone.
Do you know where you're holding? No. So it's always go for the bicep. If you brace yourself against the back of the trolley and lean back, there's no point in using your muscles, just use your weight.
Okay, yeah.
Theory lesson over. Time for the practical to begin. First challenge is to get the sedation level right.
Right, so this first one will make you feel like you've had a couple of GNTs. Alright, but hopefully it'll help with the pain. Alright?
What if she doesn't drink gin and tonic?
That's fair. What's your favourite drink?
Tea.
Don't you what? Oh, no.
You feel like you've had a few sugars in your tea.
I'm not. I don't. I'm dusting off now.
Sedating older patients is always tricky. Too much, and it puts extra stress on their lungs. Too little, and it's the heart that takes the brunt.
You feeling alright? Yeah? Well, shall we just take your sling off and see how you're doing? Is that okay? Yeah? Well done. Just going to take that off there. You're doing really well.
But as the junior team start to pull the wrist back into place,
Doing really good.
This hand underneath, all the way.
they're not sure the levels are quite right.
That arm back in the right place, alright? How you doing, Brenda?
If they can't control Brenda's pain, she may have to go to theatre.
I'm just going to give you another bit of that sleepy stuff.
Ambulances are still backing up outside Barnsley Casualty. But in the hub, Sister Jane thinks she's found a solution for her nurse shortage problem.
So where's that student nurse?
A student is about to be given some extra responsibility.
So I need to find the students to swap them because I need Olivia to do some plans.
But first, Sister Jane is going to have to find her.
Geeta, have you seen that student?
You want us?
The student. You've not got that student in there, have you, love?
On busy shifts, emergency nurse practitioners like Becky play a vital role in keeping the department moving. Their extra training means this unit is like a one-stop shop for a range of injuries.
Hello, do you want to come through? In minor injuries, it just takes the pressure off the rest of the team if we can just deal with our own patients. Because we do everything for them, we don't necessarily even have a nurse to help with, triage or do treatments, because we do everything. Come on in.
I'm coming.
With your hobble. So we do a massive part of the workload, really.
Next up is 53-year-old civil engineer John.
Right then, so my name's Becky. I'm one of the nurse practitioners here. What's happened that you've come to see us today?
I've shut door on my finger, on my hand.
Car door, house door?
Van door.
Van door, big van door?
Yes.
Sliding door?
No.
One that shuts?
Yes.
And your finger were in it and it...
Completely shut.
Totally shut?
Oh, yeah.
We're dealing with life-changing injuries rather than life-threatening. So it can be... you might have somebody like a hairdresser or a bricklayer that needs their hands, to live, to function, to put a roof over their heads. If we weren't to diagnose things correctly, then, you could lose limbs with infection and stuff like that. Did you have to open the door to open it?
No, I just pulled my hand out.
OK.
So my finger's in glove.
Okie doke, right. So then obviously a bit of panic stations and what did you do?
Dancing. Bit of dancing about, yeah.
Did you swear?
No, never swear.
And how are you feeling now?
OK.
OK, right. Can we have a quick look at it?
Yeah, fine.
OK, pop it on here for me then. I love working in minor injuries in the emergency department because you never know what you're going to get through the door, and I love having hands on. Mm-hmm. Any pain up here?
No.
So?
No, yeah.
You can feel me touching? Yeah? OK, that's fine. Somebody comes with a big, nice wound. Oh, I absolutely love that. Anything that that needs a treatment of, like, say, a dressing or a pot, or I love anything like that. And we'll get you for an X-ray.
Right.
Book in, have it done, come back. I'll come and get you.
Great.
All right?
Thanks a lot, thank you.
When you get back, we'll get you numbed, all right?
All right, thank you.
All right, no bother.
Cheers, bye.
Over in Resus,
Just give me a minute while I just get this guideline. I need to get this guy over to Sheffield.
Sam is still in shock from his burns. Advanced clinical practitioner Chantel urgently needs to get him some specialist treatment.
You want to get him in right place at right time so he can have optimum treatment.
Barnsley A&E is less than 10 minutes from Sam's work, so calling an ambulance would have taken longer. Colleague Georgina agreed to drive Sam in and wait until his family arrives.
Hiya, Kim, I'll just put you on to I'll speak to you. Sorry.
Hiya.
Hi, darling. Oh, I've just heard the news.
Yeah.
How are you? Are you okay?
I'm alright. Yeah, a little bit, but give me some morphine, so.
Yeah, alright. So don't worry, they'll look after you. They're looking after you well.
Yeah, been really nice.
Good.
Yeah.
Good. Alright, darling, we won't be long then.
Okay.
Alright, see you soon. Love you. Bye.
Love you, bye.
Sounds a bit posh, your mum.
She's well spoken, my mum, yeah. She grew up in Harrogate.
The priority now is to get Sheffield to admit Sam.
Hi, it's Chantel, one of ACPs at Barnsley Resus area. I've got a chap for referral and transfer, if applicable. Yeah, it's accident emergency, it's resource. He's got 20% full thickness burns. He's walking. That's fine. And will someone ring back as soon as possible once you've received it? That's fine. Thank you. Bye. He sounds so chill. Super chill. Right, so I've got to now refer on this website. Why don't people talk to each other anymore? I'm not talking to you. New referral. A referral to Sheffield?
Sam's burns are so severe, Nurse Kim is already having to replace the sterile dressings.
Should I get a blanket so you can rest it? Yeah.
And Sam can't stop shaking.
Sam is shaking quite uncontrollably at the minute due to shock. He's caught fire, and I imagine that can be quite scary, being on fire yourself and feeling the pain. Oh, I can't imagine what it must be like.
No, it's still my arms really painful.
It's the arm, it's really
Right. It'll hurt a while.
Advanced clinical practitioner Chantel gives the OK to give him even more pain relief.
He's just had 50 milligram of IV morphine now for his burn. I wouldn't be breathing. I wouldn't be breathing after 10 milligram. I've never given anyone 50 milligram of morphine IV before within such a short period of time. So it shows how much pain he's in.
Moving Sam to Sheffield quickly would be best. But until they can be sure his internal organs are no longer at risk, it's not safe for him to travel.
Oh, the doctor wait's just so bad.
In Barnsley Casualty today,
4.5 hours. It's just not the best position to be in.
Sister Jane is in charge of a shift that's low on nurses, which means it's high on waiting times.
I sometimes wish I could put a sign on the door saying closed for 24 hours, but unfortunately, A&E is accident and emergency, so we're never closed and we're never off duty.
But she thinks she has a solution.
Right, where's that student nurse?
Over in Resus,
How done, Brenda? Doing good.
Grandma Brenda's dose of pain relief has been increased.
That's what you mean by using your weight.
Yeah.
And student Dr. Stanley can now assist manipulating her broken wrist into the right position.
Thought Henry was nearly done. Start again.
Dr. Reddy is keeping one eye on Brenda and the other on how the young doctors are performing.
Thank you. No worries, chaps. It looks like it was a very smooth sedation and good manipulation, but the proof is in the pudding. We'll have to wait for the X-ray to actually say what has exactly happened.
If the junior medics haven't managed to put the wrist back in place, Brenda might have to go through the whole painful process again. In the next bay, Sam's huge dose of morphine has finally kicked in.
I was working in a bakery, but I was outside like trimming and putting all the hedges back and stuff, and I put it all into a big fire and put a bit too much petrol on it, obviously, and stupid. I've done my fire safety as well. How stupid's that? Silly me.
Give the wind's fall.
Before Sheffield will accept Sam, advanced clinical practitioner Chantel needs to send them some images of the affected areas.
So you're currently a hand model at the minute.
Ugliest hand model in the world.
And with nearly 20% of his body now an open wound, she urgently needs to wrap it up to stop potential infection.
This is just to like protect your arm. It should actually help with pain because it's exposed at the minute, so air will, like a tuna roll. Like in Subway. I call his arm a tuna roll. Look at it, I'm not comparing your arm to a tuna roll. You could tell he had a bit of a jokey personality, so I kind of went with it.
In called words.
What have you been called worse from a tuna roll?
Tuna roll's not bad.
What'd you get?
Tuna roll.
What'd you get called? Oh, right, oh yeah. I think it depends on your style as a clinician. and or what your personality's like. But I like to give a bit of laughter as medicine.
I feel better.
I have prescribed laughs, but no one's delivering them apart from me, so, you know. Ultimately, it would have been better for Sam to have got picked up by the ambulance crew and gone straight to a trauma centre. However, if he did, he wouldn't have come to Barnsley and be showered by 3 young girls. So, all in all, I think Sam's a winner.
What's a privilege.
Yeah.
Best attention I've had in ages.
At last, there's good news from Sheffield.
They're accepting him. They seemed really relaxed at the start. They were just like, oh, pop a dressing on, yeah, do you love that, yeah. And then they got to the last image, they went, no, he needs to come out. Anyway, he's going to best place.
Paramedics arrive to transport Sam.
See you later. I
you
look
later.
forward
Thanks
to seeing
for
your
your
face on it.
Yes,
He spent the night on the ward in Sheffield and is midway through a series of skin grafts to help minimise the long-term damage.
I feel like banging my head. Right, where has anybody seen the student nurse?
Back in the hub, Sister Jane's hunt for extra help is in full swing.
You've not got a student nurse in here, love, have you? The department is quite a big department. When you can't find somebody, you tend to find that you're storming all over the department just looking for them in every room, in every sluice, in every toilet, in every kitchen. Now, you're not a student nurse, are you, Josh? Have you become a student nurse?
Well, I'm not a registered nurse, so does that make me a student?
You're not registered at anything, are you?
Ouch.
Oh, bless you. Will you do me a favour? Yeah. I want to move you around. Will you go into rapid assessment with Joe? Can you do what?
Yes.
Can you do ECGs?
Yeah.
It is frustrating, but then they come back and you sort of, where have you been? And but then there's always an explanation. Found a student nurse.
It's gone through just the tip of the distal bone in the finger.
Over in Miners, emergency nurse practitioner Becky can see exactly how much of John's fingertip has been lost.
What did you do?
Trapped it indoor, and it just took end straight off.
So potentially, because he's got a wound, that would be an open fracture. So it obviously changes management in the fact that it might need it, you know, amputation from down here, or certainly been needing antibiotics and things like that. A&E nursing is tough. You're either a nurse that works in A&E or you're A&E nurse. You get a lot of people coming and going, and they're just nurses that work in A&E, whereas when you've got A&E nurses, it's in you, it's bred in you. Once that starts wearing off, that numbing, it's going to be sore. It's what we train for. It's like army, they're trained to go out and fight. A&E nurses trained to make people better. I think, you know, if you'd opened the door, I think it might have still been attached.
It were.
I think because you've gone like that, it's yanked it off.
Glove was stuck to the door
It's
when I
like
opened it.
bubble. Oh, were it?
Yeah, so it's probably squashed it to the door, hasn't it?
Yeah.
Yeah.
You know.
Part of his finger might be lost, but John's still got his sense of humour.
It should be more sore if he's in glove or this one.
You're good, you aren't you? You're good. Barnsley men make a big thing of things, a big joke of things to cover up, because I'm the big hard man type of thing, and you know. But yeah, they are quite. It is quite a common thing that, to be fair, with men. Righty-ho, so there you go. Codeine phosphate, 1 to 2 tablets, 4 times a day. I don't know if it's just Barnsley thing. I think it's a man thing, generally. For pain, it's going to be sore, innit? Don't be a man, be, you know.
I will.
I think it's probably because he's pulled. If he'd have opened the door, it would have probably still been intact. But I think as he's pulled it, you've had that other injury as well, if that makes sense.
A bit more of John's finger was surgically removed by the plastics team in Sheffield, but John was back at work in no time.
Thanks a lot. See ya.
Extremely sore. You know yourself, if you trap your finger in a door, they're tender, aren't they?
Olivia, are you still in there with Joe? I'm going to have to pull you out.
Over in the hub, despite bolstering the ranks, Sister Jane and her team are still struggling with the extra workload they've all had to share today.
What is this? Oh, she's done. They are tired when you watch them. At the end of the shift, they're just tired. It's just, yeah, I've got a 4.5-hour doctor wait, Julie. I can't. It's just... Well, unless people leave without being seen, it's not really going to go down.
There's no let-up in paediatrics either.
Hello, have we got Poppy?
I don't want to go to school.
Oh, you need to go to school.
9-year-old dancer Poppy has had a fall. She's been brought in by Mum Louise.
We got Poppy.
Dr. Josh Gemmell is covering the children's unit today.
Right, this'll do us. Take a seat.
Right, go.
This is Stan. He's one of our medical students as well. So you've got the whole gang here, Poppy. OK. So my name's Josh. I'm one of the A&E doctors. Tell me what you've been up to.
I was climbing back into the back seat of our van.
Yep.
And I tripped over my dance bag. So I put my hand down, which made my pinky go down first and bashed it.
And is it a bit sore now? Is that the problem? OK. This hand OK?
Yeah.
Fantastic. Get rid of that one. How are all these fingers?
Good.
Brilliant. I'm going to have a little bit of a press on you there. Is that all right there?
Yeah.
That's OK?
Yeah.
Yeah, good stuff. That's all OK. Yeah, if I have a good old press there. How's that?
It hurts.
That hurts a bit, does it? And what about over there? Yeah. OK. There?
The hand takes a lot of the brunt of injuries that people sustain because, as you can imagine, you know, our hands are how we explore the world in a lot of ways. We're not like a shark that has to bite everything. So our hands do a lot of exploring, grasping, cutting, climbing, all of these things. And so they really do take quite a lot of punishment.
Turn your hand over for me, darling. Great stuff. And can you make a fist, grab my hand, give me a good squeeze? Hard as you can. Come on. Super. It's quite sore, isn't it? Bless you. OK, fine. What we will do, OK, is we'll just very quickly get you around for a quick little x-ray of it just to make sure you haven't hurt any of the hard bony stuff. All right. If it's the soft squidgy stuff, then you can still move your finger relatively well. OK, it's a little bit difficult because it's really sore, isn't it? Bless you. But well enough that we wouldn't be too worried about it. So as long as we haven't got any fracture on the x-ray, then home. It's a beautiful sunny day. You can be out there enjoying the sun.
I have to go to school.
Oh, well, that's up to Mum, I'm afraid. I'm not going to wade in on that one. Do you want to grab your bits and bobs? Do you know where X-ray is?
I do, yeah.
Ah, I thought you might do.
In my foot.
Don't ask me why, Poppy, but I thought you might have been someone who's had a couple of trips to X-ray in the past. So follow the bones.
Yep.
All right, we'll see you back here once you're back, OK?
If Poppy has broken a bone in her hand, it could be 2 months before she can dance again.
Keep following them buns and buns.
So if you go past cubicles 17 and 18, it brings you out into the waiting room, which is there.
Yeah.
So you'll come out this door, bottom corner. You need to go walk up to where the brown doors are at the top, where that nurse has just come out of, a bit further, and that's reception.
Just arrived in cubicle 17, a 37-year-old who's had a seizure at home.
Gordon's alive. Come on, pull him off with a bit more force than that.
Oh, I'm gentle, me.
Oh.
Nurse Nicole is getting ready to treat him. And Ryan is hoping she'll show a little more compassion than his dad Ian seems to be showing.
We're in swapping ladders from one van to another. And the fellow on one side and bashed his ear on the wall.
Right, let's just get this up then.
Got me out of way.
No, just your feet. Beautiful.
What, my feet's beautiful?
If you think they are.
I tell when I got trained on.
Because of the seizure and the bump to his head, Nurse Nicole immediately takes Ryan for an urgent scan. While they wait, she can investigate the possible causes of his seizure.
What happened all this morning then?
So, right, what problem with drink?
Yeah.
Sometimes if I cut it really down, I have seizures.
Yeah. Are you cut down on your drinking then? Or?
I've been trying, yeah.
Yeah. That's when you
Sometimes I cut down too much.
Yeah, and that's when you get
Lightheaded.
Up here. Head in there.
Complications caused by patients cutting down their alcohol intake too soon require a specific treatment protocol. So Nurse Nicole brings in specialist alcohol nurse Chris to take over.
Alcohol withdrawal symptoms can manifest quite quickly. Within a couple of hours, you can start experiencing acute withdrawal symptoms. Ryan was admitted with a seizure, which potentially can be fatal. So we need to get on top of that pretty quickly.
What is the wait for walk-ins? Is it still an hour and a half?
Sister Jane has had a battle on her hands today. A department full of patients and a shortfall of nurses to help her.
So she's been done. That one's been done, but not triaged, but they've got obs on. That one's been called. That one's been done, but not triaged. Obs are on. 52-minute wait.
Your mind is just going on and on and on, and then you remember something that you haven't done and you should have done a while ago, and it's just, but you get used to it.
But getting used to it doesn't mean ignoring new problems. Sister Jane has just noticed that a 78-year-old patient has been waiting too long for a transfer in the ambulance corridor, and she's not happy about it.
Are we still waiting for transport for this dental one? Does anybody know anything about it? Sonia? I'm here. Do you know anything about the transport for that dental one? Right. OK, that's fine. He's still waiting, that's all.
When they're elderly, they shouldn't really be waiting, and in an ideal world, if everything was good, people would come in, they'd get the treatment, they'd go home, but it's just not like that anymore.
Ryan's scan is all clear. Treatment can now turn to trying to prevent the alcohol-induced seizures happening again.
Ryan? Hey up, mate. I've met you before, haven't I?
I think so,
Yeah. I had to jog my memory myself when I had a look, but it's Chris from alcohol team, so just want to go through what you've been drinking recently then, Ryan, and then we can work out what medication we can get you on and things and get you stable.
I have between 5 and 6 cans a night.
Right.
But I wake up in the morning and I have like 250ml of wine.
And is that wine, is that usually every morning as well?
Yeah, because when I wake up, I feel like sort of lightheaded.
Right.
And I think that's what caused the seizure, because I didn't have anything to drink. I only had a couple of cans of lager last night.
South Yorkshire bars in particular, they're traditionally working class areas, especially Barnsley being an ex-coal mining area. There's the old adage of work hard, play hard. Drinking culture's been entrenched in this area for a long time.
You need to get off it.
Yeah. And you sound like you've got your head screwed on, so it's just, well,
when I say
relatively, innit? Obviously, alcohol's got a lot of stigma attached to it. Ryan did not start drinking to get to a level where he's going to end up having a seizure and presenting an accident and emergency. And the other thing is not beat yourself up about it. Well, it happens, doesn't it? You've not murdered anybody. In the grand scheme of things, it's not.
I think it's just the fact that I'm pissed off and missing back down that road when I should.
Yeah.
But hey ho, let's do it.
It's not always that simple, is it? If it were, I wouldn't have a job, would I? So.
Ryan was monitored through 2 days of detox up on the ward.
No worries, mate. Take care. I'll see you later.
Before being discharged under the treatment of the community alcohol team.
Last time I spoke to him on the phone, he was really positive about things and in a good place, which is it's good to see, because that's what we do job for, really.
9-year-old Poppy is no stranger to radiology here in Barnsley Casualty.
It's just the same then, that's fine. Okay, nice and still for me.
This time the young dancer is here because of possible damage to her hand after a fall.
I'm sweating now.
Are you?
Dr. Gemmell is waiting in paediatrics for the results.
Right. Let's go and have a look at your bones. So this is your hand, Poppy, okay, from a few different angles. That's your little finger sticking out from the side there. All right. Okay, so thumb, fingers 2, 3, 4, 5. And this is the one that we're interested in, isn't it? Because that's where you're a little bit sore. Okay. Sometimes, particularly with people of your age, Poppy, where the bones are still growing, you can get a break, a little fracture. So it's very, very minor, okay? You see that? It's just that tiny, tiny little bit of floaty bone. Can you see that in the space? But that's why it's so sore. All right.
Poppy takes this latest diagnosis in her stride.
Do you want to just pop yourself through here for me?
But there's one thing she needs to check.
I'm still dance.
You certainly can still dance. Pop yourself in there.
Which hand is it, Poppy?
This one.
Most people, when they come to A&E, always fear the worst.
Oh, nearly stuck to you then. They've been coming home with you, haven't they?
It's always nice making little kids better, making parents feel a little bit better as well.
But it's not just a good outcome for the patient. On tough shifts like today,
Got your hand through there for me.
it puts a smile on the face of the medics too.
When you're having a bad day, one of the nicest things to be able to do is see the gratitude in their face, make their day, make them happy, get a big happy smile from them and kick them out the door. It's been a pleasure doing business with you, young lady, all right? It's good to see it's not dampened your spirits anyway, has it? Cheeky chappy.
Am I allowed to still climb up my ladders to get into my bed?
You can, but just be very careful with this one, okay? Because it's going to be painful for a few days.
Poppy's hand injury didn't stop her dancing, but she is avoiding cartwheels. For now.
Nice to meet you.
Bye.
Bye.
Also heading out the door is Grandma Brenda, who broke her wrist playing with her grandson.
Oh, smashing. They've been brilliant, everybody.
Dr. Reddy has given his young team a 5-star review.
I'm finally going home. Everybody here has been fantastic. Oh.
Right.
And they didn't pay me to say that.
But the feedback for the ping pong game Brenda was playing with her grandson was not so positive.
Now it's going in bin.
Won't you play like it?
No, definitely not. I'll stick to my jigsaws.
In the ambulance corridor, Sister Jane has the last piece of her jigsaw to sort. Doing right by the patient she wants to give a helping hand to.
I'm going to get him a taxi.
Sometimes we just have to think outside the box about getting a patient out of the department to where he needs to be safely.
I don't want you waiting any longer. I think it's way too long.
Get a bit tired.
I know. All right, sweetheart. You're welcome, my love.
Despite a shortage of nurses, Sister Jane manages to hand over a department in a better place than when she started.
Yeah, they've worked hard today, haven't they? They have. They always do, though. That's what makes it a good department to work in, because there's no I in team, is there, for any of them? Right, come on. Are you coming, Rach?
When you go to hand over to your night staff, or the night staff hand over to the day staff, and, you know, you've had a really, really rubbish shift, you know, you go home and think, well, I've done the best that I could have done with that shift, and I think each and every one of us will think that way.
See you in the morning.
Sister Jane may be heading home, but clocking on now is the new shift, ensuring patients get cared for at Barnsley Casualty 24/7.
Get me home.
The new series continues next Wednesday at 9, and if you or someone you know has been affected by any of the issues raised tonight, find support at channel5.com/helplines. Revealing the wonders of life in space, join Tim Peake as he uncovers the secrets of our universe, starting brand new Tuesday at 9.